Welcome back to Taking Charge of My Cancer podcast. And I have a great friend and colleague that I've been looking after for a while to do this podcast episode. This is Anneliese. Anneliese Lane is a dedicated APTA Board certified oncology physical therapist here at UF Health. With her holistic approach, she helps patients manage the physical side effects of cancer treatment, including lymphedema, scar tissue, balance issues, with the goal of restoring their health and confidence. Beyond her work in oncology, she also treats pelvic health and orthopedic patients, providing as well-rounded skill sets that informs her therapeutic plans. Before transitioning to physical therapy, she worked as a massage therapist and a certified yoga teacher. This background gives her a unique perspective of the benefits of proactive and holistic wellness strategies. She earned her doctorate of physical therapy from the University of Florida and holds a Bachelor of Science in Business Administration from the University of North Carolina, Chapel Hill. Dr. Lane is deeply committed to provide compassionate care and find joy in connecting with her patients and care team. Her approach focus on empowering individuals to overcome their challenge and reclaim a sense of hope. She believes in the power of balanced life and incorporates her personal passions such as yoga and time spent outdoors with her own pursuit of well-being. So Annalise, finally, so glad we're doing this.
Here.
Yeah, and again, if you guys heard some noise in the background, it's because it's Gator Town and the
Yep.
band is practicing, so
Yep.
that's what's happening. And we try to
Yeah.
do this outside for a change. So here you go. So
Giving it a go.
exactly. So thank you again for being with me today.
Yes, very much. And I'm from Gainesville, so this is very actually, appropriate for
Very
the
good.
band to be in the background.
That's exactly right. So what inspired you to specialize in oncology rehabilitation as a physical therapist?
I would say, one of the things I wanted to start with was, you were my mentor. When I was at UF, I did an internship with you, and you and Shannon opened my eyes to this population. Very high need, very high complexity patients. You started the surveillance program with Dr. Singhal, and you were the catalyst of this program. So I just want to start by saying thank you.
Oh, great.
Thank you so much. And we worked together, during my internship. I did a presentation on the InBody and the Zozo. And so it was a very much, a whole world basically of, how to treat patients more holistically, how to really work with so many different people on the care team. And, you and I are both forever learners. We love to learn together. We got our board certification together back in 2020. So that's a big part of why, I chose this as my specialty. I also have been a manual therapist for almost 20 years. So that, component has really helped me in this niche, working with lymphedema patients and, doing lymphatic drainage and really being able to feel the change that occurs with, the manual component. It's a very manual heavy niche of physical therapy. So it just felt really right to fall into this. And I'm also wanting to treat patients, not just on a physical level, but also on a mental, emotional, spiritual, and I love that I get to treat patients. Our surveillance program is 5 years. We get to know these women and men who are going through so much. So it's really, there's just so many different variables that I found to be, very inspiring, and you were the start. So thank you.
Oh, great. Awesome. It is so nice to see how you guys come into the clinic as an interns, not knowing much at all
Yeah.
about oncology, and see the grow and then see what you become. And now, you're like so passionate about this, which
Yes.
is, it's just so great to continue extending those roots everywhere.
Yes, definitely.
How did your training prepare you for working with people during and after treatment? Oh, cancer treatment, sorry.
Yes, I would say, my training before I became a physical therapist, I was a massage therapist and a yoga teacher. And that, like I said before, it gave me a very holistic perspective on how I wanted to treat in physical therapy. And the practice that I, offer is the work that I do. I do what I, offer to my patients. So I felt like with cancer rehab, because you're working on the whole person, even though they had cancer in their breast, there could be dysfunction in terms of balance. They could have GI issues. They could have so many different things going on. I get to really treat holistically in this area. And I feel like, my past training as well helped with that. And then, being a manual therapist is definitely something that's advantageous in this area, in this field as well. And I also am kind of transitioning into some more pelvic oncology and things like that. I think one of my biggest goals is to empower patients more and create empowerment and proactivity in our patients in order to, make it through this very complicated system, complex diagnosis, these decisions that they have to make with their providers, and just work with them in a way that empowers them to be, more proactive in the whole process.
Okay. Many people don't realize what physical therapy is as part of cancer care. What role does PT play across the whole cancer journey?
So one of my and your biggest passions is prehabilitation and educating providers on the importance of prehab and getting our patients in for education prior to treatment so that they can gain the knowledge, gain strength, connect with areas of their body that are going to undergo treatment and learn how to be proactive. This is not always really the norm in our big systems. We're a very reactive system, intervention-based system. And so I really love that part of that we can reduce or even prevent some of the side effects of cancer treatment by teaching patients to make their home program a priority, their self-care a priority. And, we do a lot to make sure that they're not losing a lot of skeletal muscle mass over the course of their treatment. And if they have to go on hormone block medications, educating them about how to minimize those side effects, because we know it takes days to lose muscle and months to regain sometimes. It's a lot of work to gain muscle mass. So I also love working with the palliative care patient population. That's also not always something that providers and mainstream medicine think of. Palliative care patients are some of my most surprising teachers. They amaze us every day.
Yeah.
Stage 4 cancer patients, managing the long-term side effects, lymphedema, bone mets, helping them track this and really increase their overall quality of life, and really, maybe even their mindset around how, end of life really looks, and having even the difficult conversations, educating caregivers on the importance of having the conversations now and really making sure that we reduce caregiver burnout, that we make sure that we're looking at the long-term goals for these people and making sure that that's a priority and that that's communicated from the patient to their loved ones, to the providers, making sure that they really are clear about, what they want and what they don't want. And a lot of us just don't, death is not something we talk about, but we're all going to, one day pass on. And the old saying that I've recently heard frequently is let death find you alive. And that was very like, wow.
Yeah. Yeah.
So yeah, those are really two very cool areas that, you wouldn't think that oncology rehab addresses, but prehab and palliative care, some of my favorite things.
That is true. And something that you're saying, one of the things that drove me into oncology was the patients.
Yeah.
I mean, it is just an absolutely population that is just it's like I just feel like I'm a different person every day because of them. It's
Yes.
just really the, you know, I mean, they just push and push and push
Yeah.
to just really looking for a much better quality of life. And they're just so receptive, and no matter how they feel and what goes, they're always trying to do, you know, complying for what we ask them to do. And most of the time they feel better, even if they're in that end stage, right?
Yes.
I remember seeing a patient at hospice, through hospice in home health. And I'm like, oh my God, how I'm gonna really manage this? And she really
Yeah.
had the best last 2 weeks of her life. She passed, but
Yeah.
she passed with a great quality of life, and the family was very grateful. Could be something different if I was not part of it. So yeah, it is sad, and again, we need to do ourselves some, you know, kind of like balance a little bit, because
Definitely.
sometimes really get us because we become so close to these patients. But
Yes.
definitely it is really like really feels really good.
It
uh
does.
to
Giving them integrity and
exactly
dignity
exactly
at that time
exactly
and letting them, you know, pass on in the way that they choose and making sure they feel empowered
yeah
to speak their needs.
yeah
And for caregivers to also receive that is been so
Yeah.
eye-opening to watch.
Yes, that's true. So how do you work with oncology teams to support patients during chemotherapy, radiation, or surgery recovery?
Yeah, I mean, our team is enormous. It's so much fun. I love it and sometimes don't always love it, but it's complicated. We work with some absolutely phenomenal specialists in radiation oncology, surgery, medical oncology, speech therapy. We just had another physical therapist from an inpatient facility come. And so I love that about physical therapy. We're all very open-minded. We're all collaborative. I feel like, there's not this, this is my, thing, or, it's just so much collaboration and working together to optimize patient care and outcomes is the priority. So you taught me that, especially like message that doctor right now, send the messages, send the email, let's go meet with the new residents every year. You present to all the residents, and if you can't do it, I'm going to step in and do it too. So and that amazing relationships that you form with other healthcare professionals across the board, across systems. We reach out to North Florida, we reach out to other programs. You have obviously worked with people all over the world at this point. So I love that part of oncology rehab. It's at this point, we, as our program, we've brought in research from all over the world. So it's amazing to learn from other professionals, give feedback to other professionals, and also, receive feedback and be open in that way as a care team. Know that as a patient, that's what you're looking for in your care team, are people that are willing to communicate, that are willing to receive feedback and to answer questions, and to really support you in being the proactive patient, and make the decisions, getting second opinions. We encourage people to, do these things so that they really feel peace in whatever avenue they choose. And so that is wonderful about our care team here, is that, we are very open-minded, as well as we just have a wonderful specialist, team of really highly skilled individuals here.
Yeah, and I think as well, our profession becomes, I remember again, I graduated a long time ago, and I remember then that was like, you know, I don't feel like we have the respect maybe that we have now.
Yeah.
Back then it's like, this is a prescription, and then you just follow this prescription because
Yeah.
it's what the doctor says, versus now is like the really, I feel like we are at the same level where it is really important, our
Yeah.
opinion, like it is really important they take in consideration what we teach them, what our part of what we can
Yes.
do for the patient. And it is really great to feel that trust, right? Like
Yeah.
I can reach out to them easily, and they know if we reach out, it's because something is going on, and they listen. So I think all that is really, a great,
Yeah.
great team to
And that's
work
how
with.
you built our cancer program, was by going into the surgeries
Yep.
and saying, hey, you're cutting this nerve, or this is a muscle that's going to be affected by
Yep.
this in this way. The tumor boards, we both partake in the tumor boards and, pipe up and say, this is the functional status of this patient. Let's take this into consideration. So that we're really thinking about long-term quality of life for these patients, and not just, hey, we can do these interventions,
Yep.
because they're very life-changing interventions sometimes.
Correct. So can you explain how PT helps with side effects like fatigue, neuropathy, or mobility loss?
Yes, one of the things that one of the best tools that we have here at our center is some machines that break down people's body compositions and BMIs. So, for mobility loss, due to skeletal muscle loss, we are measuring people's body and dividing it into muscle, body fat, and fluid, so that we can watch change occur over the course of their cancer treatment. And that is one of the biggest, most helpful tools that we have to track body composition changes over the course of cancer. We know that cancer treatment, neuropathy, can be helped with things like proactively doing balance exercises. I tell people, just, send your attention to the nerves in the fingers, trying to pick up difficult things with your hands, not using compensation strategies. And so, really, again, it's that proactive approach. Fatigue, we know fatigue is treated with exercise, and creating an exercise program. We give them based on their age, comorbidities. We look at specifically what their target heart rate should be for their home program to release those good chemicals in your brain that will naturally increase your energy over the course of time. We know that, with radiation, you potentially could have fatigue build, but we know that if you maintain a home program where you're attaining a good, target heart rate, which we have, calculated and worked with you to establish that safely, you continue to feel better and that fatigue goes away. So, I just love that we have some of these tools and that we are so, research focused here, because we've developed these kind of, techniques as a team to really make sure that we're treating patients with good dosage and therapeutically and safely.
So what does survivorship care look like from a PT perspective?
So, the survivorship is a loaded word a bit.
It is very loaded.
It's a loaded word. It just ranges, we treat everybody from very stage 0 to stage 0 breast cancer at this moment, and then up to, stage 4. Some of my patients in stage 4 do, have no cancer, anymore, which is amazing that we're at that point in time. So it's a long-term co-creation, of meeting the patient wherever they're at. Again, we see the breast cancer surveillance program for 5 years, but long-term survivorship is complex. It's individualized. It's talking about support systems. It's talking about, are you utilizing, do you have a good social support? Do you, we know that some of these things that we don't use in Western medicine, like going outside, doing stress management, regularly exercising, nutrition. We go into all these different components with our patients that are not always addressed in every Western medicine cancer system. And that is, again, unique to oncology rehab. It's a wonderful part that we get to look at all those components of the person and ask about, hydration. It's amazing, the answers you will get from your patient. It's water is really important, and status changes you can have a different baseline after cancer treatment when it comes to, basic hydration, even your blood pressure and things like that. I know we both have seen heart rate, blood pressure changes, and helping our patients figure out um, how to manage those those new changes in their body and in their whole system, systemic changes. So yeah, it's wonderful that we get a little bit more time with our patients and to talk about some of these really crucial day-to-day things that are so important in terms of survivorship.
That is true. And again, because sometimes what I hear a lot from patients is like, okay, they have all the attention, right? They got the diagnosis, the attention is there.
Yep.
They got the surgery, they got the chemo, they get the radiation, the attention is there. And then they're done with all that and it's like, no more attention. And they're like, they feel lost in the beginning, like,
yes,
now what? Now who is following me? Who is keeping an eye on me, right? Now I have to do this on my own. Now they don't do any more testing. Now I just have to wait a year to go back. So sometimes when we work with them, then we start hearing all these kind of complaints they have.
Yeah.
You know, what happened with endocrine therapy? What happened with all these secondary effects? What happened with this radiation fibrosis and all these other side effects that sometimes, the cancer treatment, which is wonderful to manage their cancer, but unfortunately, really decrease their quality of life. So sometimes, we gotta be kind of like learning and try to really be open to advise them or kind of give them options and say, look, I listen to this podcast or listen to this or go read this book and talk back with your gynecologist or talk to your medical oncologist and see what else can be done about this and start looking into other options as well besides just the medication. Because sometimes, again, traditional medicine is great because you have cancer and is the best way to get rid of it. But unfortunately, certain times it's like one medication takes care of something else. And then there's more medication and more medication. And then at this point, the patients don't have anything to do with medications any longer. So always looking into other opportunities to see, okay, what else is out there? Like you mentioned, this holistic approach and integrative medicine that we need to try to really maybe have a better open eye on it to guide them and see, okay, what else can I do? Who else, which provider can I see that can listen and can do something about this?
Yeah.
Versus just, again, another medication for the hot flash, another medication to help me sleep. So that's super important as well. So I think that how things are now that is rolling more, which is great because again, it's just helping the patients to have their own. You gotta be owner of your own decisions and you gotta own your treatment. You cannot just leave it into whatever the physicians say and you're just gonna follow through.
Yeah, and we are very passive, in our, the system kind of encourages more passive behavior in the patient, unfortunately. And we have just, started to be more proactive with our breast cancer patients on pelvic side effects from these, aromatase inhibitors. We started to dive deep into, listening to Dr. Curran Men and some other people that really are advocating for menopause symptoms in breast cancer patients to be addressed more because this is huge. This is a very big population of people now who deserve just as good, care. It's very difficult to get menopause care, even if you don't have breast cancer. But once, you have breast cancer on top of, being a menopausal, having menopause symptoms, it becomes a much harder, to get anyone to really help address those specific symptoms. And so, asking about urinary frequency, urgency, incontinence, constipation, sexual dysfunction. This is all something that we recently have just really started to embark on as a team, and it's so eye-opening. And so many of the patients have unfortunately not been addressed. And we're seeing younger and younger breast cancer patients.
Correct.
And, their bone, matters. I think of my patients as the 90-year-old version of you, because we know that, breast cancer is a curable disease, very much now, even a stage 4 breast cancer. It is very important to treat this person as a whole person. They, have a whole life, and, they have a lot of, different facets that can be impacted and deserve to be addressed.
Can physical therapy help reduce the risk of recurrence or secondary health issues?
Definitely. So research shows that exercise reduces cancer reoccurrence risk by 25 to really 37%. So, the more I learn, it's so amazing, because we know radiation has a methodical way of treating cancer, chemotherapy has a methodical way, but we have our own body's healing system knows how to heal itself. And cancer cells, the micro tumor environment is very responsive. We know that improving basically by infiltrating and creating increased blood circulation, you're getting that chemo into that microenvironment. You're creating you're reducing tumor hypoxia. You're basically creating, an increased immune response. A lot of the Western medicine, it's decreasing our body's immune overall function. So you are, again, increasing that with exercise. And overall, just showing how exercise can take those areas and improve patient outcome and immunotherapy response. So it's amazing to know that this tool is just as effective, if not potentially more effective, than some of the traditional therapy techniques that people receive. And it's just very little is sadly known, because, you can't really profit off prescribing exercise.
Yeah, and then I'm kind of glad you mentioned that. Actually, that was a paper, or that was a publication got presented at ASCO last year. For the audience that doesn't know what ASCO is, it's like the national meeting for the medical oncologists, and it's like over 40,000 people. And one of the medical oncologists presented a trial for colorectal cancer, and shows that, and that was like a 3-year follow-up, and showed that the exercise group with these patients actually have 47% decrease on recurrence of colorectal cancer. Wow. Versus the other group. So they were like, my God, this is actually can be even better than chemotherapy in many situations. So it is really great that not just us as a physical therapist presenting and doing research, but now really is great for the medical oncology group to start looking into these amazing effects of exercise that is really easy to implement. And we just have to educate the patients. And then we know, because we've been doing this for a while already, where we see patients before their infusions, and it's amazing the secondary effects, how less they, like how much better they feel versus less nausea, less fatigue.
Yes.
The response to chemo is better. So I think I wish, more and more, we do it in our system, we're getting that more, the medical oncologists are listening more to that, they're getting more used to that. But it's nice to see that as a standard of care across the board on every institution, right? So, but it's smaller steps, we get in there.
Small steps, but definitely, the physiology, to learn about the physiology behind how, affecting the tumor environment, making the tumors more sensitive to the cancer treatment, and then just overall boosting the immune system. These basic things that are improved with exercise.
Correct. How do exercise and movement improve not just physical recovery, but as well mental and emotional health?
So, from my yoga perspective, this is, a very powerful, very important part of our treatment. And another area that needs to be, we don't have a mental health component when we're going through cancer treatment most of the time. We're lucky we have occupational therapy at our center with a therapist who focuses on stress management, mindfulness, habit forming and goals implementation. He is wonderful that we have that, but that is unfortunately not the norm. And going through cancer treatment, having a part of your body removed is a bit of a trauma. And so really acknowledging that body dysmorphia, managing expectations is huge. You know, we're, again, it's like a customer service, a little bit focused feeling system sometimes. And, you know, breast reconstruction, the amount of, you know, surgeries, it's all very, very complicated and needs to be, you know, communicated more to the patient in terms of what expectations are and how to manage that. I think what I see a lot is my patients kind of become more disconnected from their bodies. They don't even want to touch the area where they've had their cancer, you know, removed. So really the mental component for me and emotional component is, you know, just here, taking a deep breath, you know, having the patient, inviting them to place their hand on the area, and we teach them how to, you know, potentially work on the scar tissue. We teach them how to manually drain areas that are developing, you know, any swelling or lymphedema from the surgeries. But really, you know, encouraging our patients to reconnect, you know, look inward, internal. We're a very externally focused world right now. Very rarely do we pause and breathe. And remembering that when we heal, we are in rest and digest. We are in that parasympathetic, relaxed state. So that component of, you know, getting a cancer diagnosis triggers. This is a fight or flight situation.
Yeah.
We need to deal with this in our bodies. So we also need to reset the body to be able to come back to rest and digest, to heal. So that is crucial, and also, you know, an area where we have a little work to do. So know, as a cancer patient, that is a huge priority, you know, not just during, but after cancer treatment. Like you said, so many of my patients, it's after, when they are, you know, no longer seeing the providers as often, and they're coming back to see us at that, you know, 2-3 year surveillance appointments, talking about, you know, the mental component of, this has really hit me now, you know, because they were in survival through the whole thing.
Where did you see oncology rehabilitation headed in the next 5 to 10 years?
You know, I think oncology rehab is gonna really explode. I think people are becoming more aware. I think, you know, oncology rehab is a catalyst of change in the field of cancer treatment. You know, you're a perfect example, walking into a surgery and saying, hi, this is, you know, what's going to happen, more explaining to the other providers on the impacts long term. You know, even, one of the ones that I think of regularly is the latissimus flap for our patients, you know, and watching our patients, you know, have trouble with basic things like, you know, toileting, or, you know, taking into consideration, you know, are they an active person? Are they an athlete in some way? So really, that's why, again, seeing the patient before any treatment is really ideal, to talk through and get to know them, and to explain, you know, if they're choosing this route or that route, you know, how it could impact their quality of life long term. I feel like we're changing the standard of care by demanding better quality of life for our patients post-treatment in the field of cancer rehab. I think we are seeing very cool research coming out of all different parts of the world. I don't really feel like the US is the leader sometimes. You know, Australia, Mexico, Europe, they're using embryonic tissue for cancer treatment development. And I think that what we're going to see in terms of change over time, you know, we're open-minded, we're taking the research from everywhere and we're implementing it. And what my hope is that we can continue to educate other providers about the long-term side effects and make those side effects known. I think also, AI will change, our healthcare system and place, a patient's full medical history, their overall, cardiac risk and family histories. All of that can be kind of looked at and hopefully can really more so individualize care so that we can look at the whole person and the potential for risk and side effects long term to really make sure that we treat more proactively.
Very good. And is there any new research findings or techniques that you're excited about that will transform cancer rehab?
We are doing a very cool study here, with exercise in our chemotherapy patients, which is amazing. The study is, assigning different forms of exercise to these patients, and I am seeing a huge change in my patients who were sedentary prior to chemo, because they're held accountable to exercise during chemo. Totally different outcomes are, what I'm seeing. And they feel, like you said, they feel so much better when they're exercising regularly during chemo. And then it gets them into this, routine of really realizing how important a regular self-care exercise program is for the long term. We're also doing some amazing research. You're doing it with Dr. Spiegel, with mapping the lymphatic system of every individual while they're in surgery. We actually have pictures of the map down the arm so that then we can teach the patient specific drainage techniques for their body. So if, and watching that over time is I think going to be another major change. It'll be amazing when that's the gold standard and is implemented across the board. So those two here at this center, I'm super proud of and super proud to be a part of. And so, yeah, I think it's amazing. I think the work that Dr. Singhal is doing up in Boston, it's amazing work, mapping out the full lymphatic system finally.
And they actually doing what we want to do, hopefully, which is what Australia is doing, which is MLD under ICG. So they actually inject it, and then the therapist can actually see what the path is, and then teach the patient how to do manual lymphatic drainage. And they can actually see on the camera, like, oh, if you don't put too much pressure, you don't see any flow going. And it's like, this is kind of what we wanted to get to at one point. So hopefully we can do that at one point. But yeah, they're like, I think this is the only institution so far who is doing it here in the States. So yeah, amazing work. And then we're so fortunate that even though he used to work here and moved there a few years already, it's still like a part of us. So it's still sharing his knowledge and it's still getting us involved. And I have a couple of my guests has been part of their program, which if the audience wants to know more about it, so you can look into the last episode I did with Dr. Singhal. I was really excited. He just kind of published a new anatomy, lymphatic anatomy that he just found out in the last few months. So it's really great to the passion about it. And like I say, we are so grateful that we've been surrounded by these like amazing physicians that only want to try to really learn and learn more and more. So
yes. How amazing is it in 2025, we are still figuring out the anatomy of the human body.
You got it.
The lymphatic system, which is your body's immune system.
Yeah.
One of the most important systems.
Exactly.
And then now we get to teach patients how to individualize it to them.
Yeah. Yeah.
So yeah, very cool.
Anything else you want to say to wrap it up?
No, just thank you so much for this work that you're doing. Again, you are a catalyst of change, and I'm just so proud to be working with you. And I just am so thankful for you starting this program. And it's been, I don't know, I guess 17 years that you've been here and about 10 years that I've been here. And I just love it. I feel like I continue to learn so much. But, definitely, continuing to follow you. I will be doing that forever.
That's awesome. That's awesome. Thank you so much. So great to be working with you today
Yes.
too. Well, thank you again for this interview finally.
Yep.
I know life gets busy,
Mhm.
but thank you again.
Yes, thank
All right,
you.
great. See you later.
Have a great one.